hustle and bustle at the U.S.-Mexican border. Many of the Americans that come here needed inexpensive prescription drugs. Others seek treatment for various illnesses and surgery. And each year, the number of Americans receiving treatment in the developing world goes up by 10 to 15%.
I think there are some physicians here who really feel like patients shouldn't leave the country to get health care. I actually don't agree with that. I think that if someone was facing a situation where they really had no resource and no access to a safety net to get health care in this country, then seeking health care outside the United States might be their only option to get care that they need. I think that the deepest part of the problem are people who really don't have any kind of insurance, and therefore they don't have access to either preventive health care or even emergency health care when they need it.
Is the doctor back here?
Minnesota housewife Barb Essick is a cancer survivor and one of tens of millions of Americans without adequate health insurance. She is in Mexico for dental treatment. Despite its poverty and rickety infrastructure, Mexico boasts qualified doctors and dentists at a third of U.S. prices.
Back in the United States, we have no dental insurance. I've been doing it down here only because of cost. And I went back yesterday, and he did my lower teeth on both sides, and on both, all the way through the back, both sides, was $500, and basically back in the United States it would have been about $5,000 to have the same procedure done.
Barbara has been coming to a Tijuana dentist, Dr. Robles Cortez, for the past 3 years.
Teeth that are so sensitive, I swear the nerves are right at the bottom of them, but I don't know, he's special. He doesn't hurt, so I don't even go to the dentist back home anymore.
Like Ed and Frank, Barbara returns home with suitcases full of bargain medicines and vitamins from Tijuana pharmacies.
One day I go do all my vitamins, and so these are the vitamins I take back, and I can tell you this Q10 that's sold in the United States, and that alone, back in the States, the last time I bought it, I paid $65. And down here, I paid like $13. These other boxes here, now this kind is just a multivitamin, which, again, you can buy these back in the United States, but it's just so much cheaper to buy them down here. This Furrow 4 is an iron, just a basic iron, and iron's always cheap. I think I paid $3 a box for this. So I graduated.
Barb, a mother of 6 with a full-time job, first heard about medical care in Mexico through publications and ads in a glossy U.S. magazine like this one from Mexican cancer clinics.
Oh, dear.
But doctors at this clinic and others we visited in Tijuana would not agree to be interviewed or videotaped. Their reticence stems from a Mexican government crackdown following the death of the terminally ill Coretta Scott King, widow of the American civil rights leader Martin Luther King, at a Mexican clinic in 2006. Dennis Hellingson explains the circumstances while the hospital staff forbids us from filming.
Get her down to 4 days of evaluation, she dies. She's a dignitary. So the U.S. got with Mexico's medical association. We're going to have you look at a lot closer to all these clinics that are down in Mexico. So that's what will happen.
The Mexican government shut down that clinic because it was performing treatments with no license and began to more closely scrutinize other treatment centers catering to foreign medical tourists.
I'm all ready to go. Tonic in hand.
But Americans like Ed, desperate for a cure, hide away months' worth of supplies in their suitcases before recrossing the American border. Advertising the tonic as a cancer cure is illegal in the United States. Its sale is also illegal, and even importing the treatment in large quantities for personal use is not condoned by the American import authorities.
This is the famous Oxy tonic, the supplement. It's 4 ounces of tonic with, or rather 2 ounces, it's going to be 2 ounces of tonic with 14 ounces of water each time I mix it.
Barbara Essick gets ready to return to Minnesota with her bag full of medication and vitamins. Barb, along with millions of other Americans affected by healthcare costs and services, will be voting in next November's presidential elections.
I do remember the days when Hillary was, and I'm Republican, sorry. But I do remember Hillary, you know, taking this on. But you know, when you've seen her campaigning now, she doesn't say boo about this anymore.
Many Americans are watching closely how the candidates are handling the healthcare issue.
I think we're standing on a burning platform. And frankly, this problem has been increasing over the last few years. I'm pleased to see that it's taken center stage as the most important issue in Sacramento today, and it appears like it's going to become one of the most important issues that shapes the presidential election. Well, that's unprecedented for health care reform to have reached that level of urgency.
Presidential candidates, particularly in the Democratic Party, supported plans to provide health care insurance for the 47 million uninsured Americans.
And today, as we strive for a new beginning to the 21st century, I believe everyone, every man, woman, and child, should have quality, affordable health care in America.
The Republican candidates are against universal health care, claiming it allows for too much government interference and is too costly for the taxpayer.
Instead, we should rely on the private markets to guide health care.
But Democratic candidates are adamant that change in healthcare policy is urgent.
We now face an opportunity and an obligation to turn the page on the failed politics of yesterday's health care debate. The time has come for affordable, universal health care in this country.
American healthcare professionals tend to agree that the crisis has reached a peak.
How long did it last?
A couple of weeks.
We're one of the wealthiest countries in the world, and it's shameful for us to have such a large segment of our population not have access to what we can provide, which is some of the best health care services in the world. That's shameful for us as a so-called first world nation.
But some critics continue to disagree with all the candidates, who at best believe that universal health care coverage is the main issue. Charlotte Gerson and many on the American medical left say that the standard medical treatments are too costly and often ineffective, and that Americans should have a greater choice about the type of medical care they get.
No doctor is allowed to use something else. It's only forced by law to use the therapies that have already been used and have failed. And that, by the way, I consider unconstitutional.
As the debate about what kind of healthcare policy Americans need continues between politicians and experts, many Americans just continue in their search for treatment abroad.
You might have friends you might want to stay with you, or family.
For people like Dennis Hellingson, which candidate wins the presidential election will not change much. He is concerned about his clients' welfare.
One negative thing about this whole experience is getting back in the United States because of the security. It can be 2 hours waiting in line, trying to get through. And for somebody who's sick, that's tough.
So is the future of American healthcare at a turning point? Will voters opt for a system closer to that of other Western industrialized nations? Or will Americans simply continue to shop the world for the affordable and alternative healthcare that they need?